Hi everyone, this is Dr. Konstantin. I'm a facial plastic surgeon and a facelift expert, and today I have a very interesting topic to discuss. It's procedure combinations that make sense to do together. If you're considering a facial cosmetic, facial rejuvenation surgery, there are certain procedures that work very well when you combine them, and other procedures, you don't really have to combine them. You can do it separately and it would be perfectly fine. So let's first discuss why. Why would you actually want to combine two procedures together? Why would it make sense to do? Why not just do one procedure now and then another procedure maybe a year from now, and then the next one in another year, right? So there's a good reason to do that. So number one, it makes the results look more natural. There's such thing as aesthetic subunit, and when we look at somebody's face, we are not really looking at the entire face. We're looking at the parts of the face, at one part at a time. And it could be not just one part, it could be two parts together. But when we're looking at somebody else's face, we perceive it as one part. Now, the second reason is that certain areas of the face, they tend to age together. And when we're looking at somebody, we expect that. If somebody has sagging in one area, we expect them to have sagging in another area adjacent to it. And when we don't see it, we start suspecting that something is going on. There's something happened here. Maybe somebody had a facelift or another surgical cosmetic procedure, because we are not recognizing just the normal aging pattern that we used to when we're looking at somebody. And the last one is optical illusion. There are certain parts of the face, when one part looks a little bigger, it makes the other part of the face look a little smaller. And the opposite is true. So certain procedures come together because when you enhance one area, it actually makes another area look better. So for those three reasons, we like to combine some procedures around the face or neck area. Now, enough of the suspense. So what are those? Well, face and neck lift. This is definitely will be number one in my book. Those two things have to be done together for the reason that those areas typically age together. When somebody has jowls, they usually have neck laxity, and the other way around. Now, it's certainly possible that somebody's neck would age a little faster than the face and vice versa, but for the most part, this holds true. So if somebody does a procedure, tightening the jawline, doing a facelift, but not really taking care of the neck, or the opposite, doing a neck lift, but not taking care of the jowls, people who look at the results would say, well, something is going on there. Something is not right. It doesn't look like I would expect it to look, and therefore, probably some cosmetic procedure was done. Now, the next one would be upper and lower blepharoplasty. And again, the reason is that the eyes age together. Usually people who do the upper eyelids, they need to do the lower eyelids, but it's not always the case. Sometimes this is not what's happening. But a very important reason for somebody to get those two areas done together is to actually be able to look in the mirror and say, my eyes look good, right? So if somebody just does the upper eyelids and they still have the bags under the eyes, they tend to look in the mirror and say, well, yeah, my upper eyes kind of look better, but I still have the bags, so I'm still not very happy about it. And the opposite is also true as well. If somebody gets rid of the bags under the eyes, but they still have that sagging skins on top, now they're going to be saying, well, under the eyes look really great, but I still have that sagging skin that prevents me from putting makeup and I don't like it. And oftentimes patients like that say, well, why didn't I do it all together, right? So it actually makes sense because the aesthetic subunit, the upper and lower eyelid, is the same. And when we look at it, we don't really in our mind separate the upper from the lower. We just look at the eyes altogether, right? So it makes sense to rejuvenate the area altogether because this is what gives you that nice positive feeling when you look at something in the mirror and say, oh, that looks very good. And the last one, of course, is a very common combination of a rhinoplasty and a chin implant. So rhinoplasty We can change the shape or the size of the nose, and the chin implant sometimes plays a big role in it, because when the chin is bigger, the nose appears smaller. And this is optical illusion. This is something that when we look at the face, it really makes us think that it's smaller, when in reality it's not, but it always happens, and we can use it to our advantage. So when the chin is enhanced, when it's made bigger by using implant or maybe filler or fat grafting, this rhinoplasty surgeon does not have to do quite as much work on the nose, reducing its size. So there are definitely reasons why plastic surgeons recommend certain procedures to be done together. So don't be surprised when you go and get your consultation and the doctor says, okay, great, we'll be very happy to do this for you, but I would also recommend to add this procedure because the result will be even better.